Hi, I'm Colleen Cullinan. I'm a pediatric psychologist at Nemours Alfred I. DuPont Hospital for Children, and today I'm going to be talking about pediatric sleep. In talking about sleep, it's really important to recognize that sleep has a profound effect on functioning across domains. Physical health, cognitive functioning, academic functioning, school attendance, internalizing symptoms, anxiety and depression, externalizing symptoms, hyperactivity or disruptive behavior, social functioning, and lack of sleep can impact differently across the developmental spectrum. So an adult is going to have different kinds of deficits for not getting enough sleep versus adolescents, versus young children, versus babies, but sleep is important across all of those different developmental levels. And the good news about sleep is that parents recognize that it's a really important thing for their children. The majority of parents, over 90%, feel that sleep is either very important or extremely important to their own mood, their own health, their own importance, their own performance, as well as their children's mood, health, and performance. And so these are some data coming out of the National Sleep Foundation that just show that this is something that's on parents' radar that's important to them as well. So we know it's critically important to talk about sleep, to ask about sleep when we're trying to evaluate children's health. And I wanted to share with you a screener that allows you to ask some questions about sleep quickly and efficiently. So this is the BEAR screener, and it's an acronym that goes down for talking about bedtime problems, excessive daytime sleepiness, awakening during the night, regularity of the sleep-wake cycles, and snoring. And I think it's really important as medical professionals to be asking questions about snoring and determining if we need further testing or sleep studies, things like that. When you're asking about bedtime, it's really important to ask about difficulty going to bed, difficulty falling asleep, difficulty staying asleep, asking questions about what time is bedtime and what time do children actually fall asleep following bedtime, what time they get up in the morning, a general question about the average duration of sleep. And most sleep problems pop up, like I was saying, it's important to ask about sleep across the developmental spectrum, but most sleep problems pop up in this age range about 3 to 6 years. So there's a lot of different reasons for this. Part of it is that this is the age when kids start going to school, and then their sleep cycles, their sleep-wake times, and when they're going to bed usually shifts a little bit. This is also the age when we're recommending that families cut out the daytime nap. And so this is a time period where you see a lot of new sleep concerns or difficulties with falling asleep, staying asleep, getting up in the mornings. It's also a time when kids are pushing the limits a little bit. And so limit setting becomes more difficulty in this age range, and that applies to bedtime as well. So discussing with families the bedtime routine. A bedtime routine should include calm and enjoyable activities, bath, shower, stories, songs, things like that. And we should really be trying to avoid stimulating activities or high energy activities. So this includes things like running around, playing outside, roughhousing, things like that. But you also do want to address screens and screen time during this discussion of the bedtime routine to make sure that we're trying to eliminate screens from the bedroom. It can be really helpful for kids this age to make a chart of the bedtime routine, a visual schedule, to help kids keep track of what step of the routine that they're on, and kids can be a part of making this routine. So it offers an opportunity for families to talk about the bedtime routine and for kids to participate in the creation of the bedtime routine. And the very last activity of the bedtime routine should be something that's a pleasant or enjoyable favorite activity. So it could be reading a book or singing a song or talking about the things that we're grateful for during the day, but something that's calming, quiet, and not stressful right before we go to bed. The next intervention that I really like to talk about with families in this age range is something called the Bedtime Pass. So the Bedtime Pass program is a very neat intervention. It requires kids to get in bed at bedtime, and it's a really good intervention for when kids go to bed, but there are several curtain calls. Times where kids are getting out of bed asking for a drink or to have one more hug or one more story or one more snack. The Bedtime Pass program is really good for these kinds of issues. And so you help kids create a pass. I usually use like a 3x5 index card. And you give the child the card. It's good for one trip out of the room every night. So kids can come out, they can get their one more hug or one more drink, whatever it might be. They cash in the pass, and then they go back to bed. Once you use the pass is surrendered for the night. And if kids leave the room again, parents can feel confident just kind of neutrally taking their kids, turning them around, and putting them back into bed without any sort of emotion or negotiating or conversation. So this can be really helpful in getting kids to go to bed quickly and without a lot of fights, power struggles, arguments. One book that I really recommend frequently for families is The Sleep Fairy, which is kind of a story or a play on the Bedtime Pass program. So the Sleep Fairy is kind of like the Tooth Fairy. She comes in at night, and if she finds children sleeping in their beds the way that they're supposed to, she will leave like a prize or something nice for the kids, or leave it with their parents and they can pick it up in the morning. And this is a really nice book that you can read before bedtime that kind of plays on the Bedtime Pass program. This is a book I recommend a lot. The last intervention I want to talk about is an intervention called fading, and this is a really good intervention for when kids have bedtimes that are way out of line from where they should be. So if you have a kid who you're hoping is going to go to bed at like 8 or 8:30, but is actually going to bed at more like midnight, this is a really good intervention to use. So it's really important to wait until kids are actually sleepy before trying to put them to bed. When kids are not tired, it really just increases the likelihood that you're going to have problems at bedtime. So for some kids, the thing to do is to set the bedtime at that late hour when they're falling asleep anyway, and then gradually start to fade that back. So you'll do something like set a temporary bedtime. So if midnight is the time that your child is falling to sleep, set that as the purposeful bedtime. Do the bedtime routine before that midnight time period and have them go to bed at midnight. And then you can start to fade back that time to the appropriate bedtime. What I mean by that is if you have a child who's going to bed at midnight and you set that as the temporary bedtime, once they're going to sleep nicely at midnight, you can start to push that bedtime earlier. So the next week you can push it to 11:45. The next week you can push it to 11:30. The next week you can push it to 11:15. So very slowly but surely working your way back to a better bedtime, one that's healthier for the child. And once they're falling asleep easily and quickly at each of these new bedtimes, you can start making it a little bit earlier, a little bit earlier. This requires a lot of patience, so preparing families for that, but it's a super powerful intervention for getting kids to fall asleep closer to when they're supposed to be going to bed. So in conclusion, asking questions about sleep is really important. It provides an opportunity for you to join with the parent about an issue that's very important to a lot of families. Behavioral interventions work. We know that in a lot of different studies, the majority of kids will have improved sleep if their families can consistently stick with sleep strategies and sleep interventions. And there's absolutely no harm in referring families with pretty significant sleep problems to a psychologist or a behavioral health provider. Small changes can make a really big difference in sleep. So make sure that you're recommending or giving out handouts about things like Affirm a Bedtime, Bedtime Pass, the bedtime routine, fading bedtime. Just giving that information out will help make sure that these kinds of things are on families' mind and will empower them to try some of these really easy strategies. So in conclusion, feel free to talk to families about sleep. I hope that this talk was helpful. Thank you very much.